Hello and welcome to The Way We Roll with me, Simon Minty.
And me, Phil Friend.
Our guest this month is Sir Charlie Mayfield. After a 5-year military career, Charlie went into business and consultancy and ultimately became chairman of John Lewis up until 2018.
Alongside this, Sir Charlie served as a member of the UK Commission for Employment and Skills and chaired it until its dissolution in 2017. And then in November 2024, he was asked by the Secretaries of State for Work and Pensions and for Business and Trade to lead the Keep Britain Working review.
Now, this is an independent review in how to best support and enable employers to recruit and retain more people with health conditions and disabled people and promote healthy and inclusive workplaces.
The first paragraph in the executive summary says the UK has been sliding into an economic inactivity crisis driven in large part by ill health and by barriers to work faced by disabled people. This is holding back growth, damaging people's life chances, and costing the UK billions in lost output and welfare payments.
But it continues, it need not be this way. This is a serious but fixable problem. However, it can't be solved by government or employers acting alone.
So, just before we meet Sir Charlie and begin to ask some questions around this report, some just quick facts for you. So, 2.8 million people are economically inactive due to health conditions. That's 800,000 more than in 2019, a 40% rise in 5 years. Only 53% of disabled people are in work, and people with learning disabilities, it's just 4.8%. Disabled people are nearly 3 times as likely to be economically inactive as non-disabled people. And here's one that really stood out for me. 300,000 people with health conditions leave work every year. The total cost of health-related worklessness is 212 billion a year, roughly 7% of GDP. And the mental health inactivity among 16 to 34-year-olds rose by 76% between 2019 and 2024. So, Charlie, before we get into all of that and the work that you did, can you start by just telling us why you took on the role? Because
Yeah,
this is enormous.
sure. No, well, thank you, Phil, and thank you, Simon. And it's great to have the opportunity to be with you. Why did I take on the role? Well, I was called up by Liz Kendall. She was then the Secretary of State, or actually not by her directly, but by her office, and asked if I was interested in this. And then when I looked into it a bit, I thought, well, I am actually, because I guess my time at John Lewis Partnership had sort of taught me that work and life are very closely interwoven. And those of us who are lucky to be in work and hopefully in good work gain an enormous amount of fulfillment from that. And actually, therefore, people who aren't, or people who have to fall out of work prematurely for whatever reason, are then losing that dimension to their lives. And I'm a firm believer that in addressing some of these challenges, and you just had to look at some of the figures. I mean, even before we published the report, some of the numbers that you've referred to are out there. I could see this as an enormous problem. And I've also felt for a long time that too often, when faced with big problems in this country, we either look to the government or to employers to solve them. And often most of them are better solved if we can bring employers and government together, rather than what happens usually, which is they just shoot straight past each other without properly listening and paying attention. And so I just hoped that maybe I could both understand the problem and encourage more of that kind of approach to resolving it.
And you spent about a year doing this review, and I know there was a sort of publication in November and then an update. What sort of pups stuck out? Was there something that when you were doing this, you were like, oh my goodness me, it really surprised you?
Quite a lot of things, but I mean, the first thing I should say is that it was about 9 months, the review phase. And one of the things I did early on is I looked at all the other reviews that have been done in this area. It's quite a lot. I mean, there's some really good work by, Carol Black, for example,
Yes.
Paul Farmer and Dennis Stevenson done some great work in this whole broad area. And I read all their reports, and what I saw is that they'd analysed the situation pretty well, as you'd expect, and they'd made recommendations, which all looked fairly sensible. But when you then thought, okay, but when you went down the list of the recommendations, I mean, the first thing I'd say is there were a lot of them, but in some cases 20 or 40 recommendations, and you went through them, and you could see that clearly they haven't happened. Otherwise, I wouldn't be being asked to do this review. So one of the things that struck me, or I had in my mind from very early on, was that the end game is not the writing of the report. It's actually making the change happen. And if you write the report and just leave it on the table for someone else to pick up and do it, like most things in life, it probably won't be done. Particularly if you leave that someone is government, which is hugely distracted, got so many different priorities, got people moving around all the time. It's not surprising that stuff doesn't get done. So I sort of approached this with a view to saying, yes, we need to do the review. We need to write the report, which shows what the problem is and makes some clear recommendations. But I also felt very strongly that actually my responsibility was also, if the government wanted me to, was to stick around for the implementation, and that's what I'm doing now.
Right.
Just to build to your question there about what surprised me, I'm not sure surprised as awakening, more of an awakening of sort of the significance of a few issues. And there are three things I would mention in particular. The first is that around the whole question of ill health and disability in the workplace, there is a tremendous amount of fear. So if you're a person who has a health issue or has a disability, very often you're a bit afraid of telling your employer about that. That's probably your first instinct because you're worried about judgment. You're worried about how you're going to be treated, all sorts of things. It may be very private, something you don't particularly want to share, particularly if it's a new employee, you don't know the people. So fear for the employee is very understandable. But that fear is also felt by the employer. A lot of employers and line managers, when they encounter health issues or disability issues, they will often be afraid of stepping in and engaging people in that because one of it's very human. It's a personal thing, and they don't want to sort of say something wrong or cause offence. They definitely don't want to do something which gives rise to a complaint or appears insensitive, and let alone a grievance, and let alone a tribunal. So, but the point is, so you've got a lot of line managers and employers who are also afraid, and you've got a lot of employees who are afraid. And what happens is that fear creates distance between people. They don't talk, and they don't discuss, and therefore issues which probably could be resolved through discussion and just human contact are not. Second big thing, so that's the fear issue. Second big thing was the system is then exacerbating that distance. So, there are a number of things, but we don't really have a proper system for supporting employees or employers in the context of how you handle ill health and disability. We kind of expect them to get on with it. I mean, in the context of disability, if you take something like reasonable adjustments, it's enshrined in law. It makes a whole load of requirements. But most employees and most employers are then pretty well unsupported in terms of how they navigate what is reasonable and what isn't. And we sort of expect that to get resolved. So what you're effectively doing is you're leaving a slightly tricky judgment to be reached between two individuals who may not know quite how to reach it. And sometimes that can end up in conflict, which again creates distance. And then there's a whole thing about GPs and fit notes, which I could go on about. So the system is exacerbating the problem or the lack of a system. And then the third thing that we really pulled out, and in some ways it's not a separate thing, is the level of exclusion faced by disabled people. Because everything I've said about fear and everything I've said about system is kind of multiplied several times over if you're a person with disabilities, with a disability. And I was, if there was an area I was shocked, it was about that. And I think, I go around when I'm talking to people about the review, I often tell the story of Sheila. Now, it was in a round table in Glasgow about a year ago, and in fact, I told this story literally day before yesterday in Hull. Yesterday in Hull, and we had a great roundtable discussion. Sheila had come into it with her guide dog. She's blind, and then right at the end, as I was sort of summing up, saying thank you for coming, really useful input, she said in a really quiet voice, "Yeah, I was 49 when I got my first job, and I had 5 degrees." And I always stop after that, and I just let that sink in. And I say to people, just think what the 30 odd years of her adult life have been like, where she was able to work, wanting to participate, and was basically not able to do so. And just imagine what that, let alone the economic consequences, just imagine what that does to someone's heart and soul and how they feel. And it's shocking. And then you go beyond that and you look at you mentioned the number. If you're someone who has a learning disability or learning difficulty, less than 5% are in work.
Yeah.
It's
I
Can I
think
shocking.
it,
just can I just ask a question before we go on? I'm interested to know how you differentiate between ill health and disability, because I think for many, that is a kind of bridge that has to be crossed. What kind of definitions or whatever did you use to separate these two things out? Because clearly Sheila was disabled.
Yeah,
She wasn't
yeah,
ill.
absolutely.
But yeah, so what's your take on that, Charlie?
So, I mean, the first thing to say is we've got into a bit of trouble with some organisations who've taken real issue with the very fact that we mentioned both ill health and disability in the same
Yeah.
sentence.
Yes.
I do understand where they're coming from, and we have been tried to be at pains not to conflate the two, because disability is not ill health. Having said that, it is true that disabled people also get ill, so the two are also connected. But we've tried to, and I don't think we've succeeded, but we've tried to say to people, look, we're not treating the two as the same. We are not treating disability as a health issue. We are, but we are recognizing that we're being asked to look at employers as a group and how do they play a bigger role in supporting people with health issues and disabilities to stay in work and to thrive in work. And so our audience, in terms of the number one people we're speaking to, are employers. And so we kind of have to somewhat look at it through their eyes and say, right, so how do we work with them to try and figure out what to do? I also think that there are some opportunities as we start to move into the solving this. How do you solve it? That if we can create resources and better sources of advice, and we may find, we haven't got to this stage yet, but we may find that if we can create better resources and advice for employers around how they handle health issues, there may also be opportunity for the same advice or the same people to be the expert advisors around how they handle issues to do with disability, including things like reasonable adjustments. So
and
we tried to keep the two separate, but I kind of acknowledge that we haven't pleased, that people have been concerned about that. I think I
Sure.
understand their concern, but I hope what you can understand is we're really not trying to conflate the two. We're actually trying to treat them separately, but we've got a job to do. And we're trying to crack on and address it.
we did a podcast 2 or 3 years ago, which was long-term health conditions and
Yeah,
disability. What was it? Kind of where do they overlap and where are they distinct? It
yeah.
is our most listened to podcast
Is it?
because there
Yeah,
is, and I think disabled people sometimes being very protective, saying, "Don't muddle us up." It's
yeah,
back to the fear though, because if
yeah,
you think I'm sick as well,
yeah,
you
yeah,
are really going to struggle to get an
yeah,
employment. I
yeah.
take that distinction. Um, you mentioned about the lack of support. So two individuals are trying to work out what reasonable might be. Now, when we work with large organizations, they have policies, procedures, they have HR departments, they have business partners. There's Business Disability Forum that I know you've spoken at. I think there is stuff out there. So are they, why is that still an issue when there is support out there? Maybe they just don't know where to go to. Or am I only thinking large employers, not small, under 20 employees?
I think there are a variety of issues. I mean, you're right. There's lots of advice out there that you can go and find. But if you're a larger employer, I think it's fair to expect people to have the resources in place and the systems in place to handle that. But if you're a small employer and you're almost struggling for survival, or you're thinking your whole world of work is much more near term and in your face and pressing, even the fact that you have to go and find something is probably a reason why you probably won't. Not because you don't want to, it's just that other things become a bigger priority and they crowd out that space. And and then I think there's a further point here, which is that I think there is a fear amongst some employers, and I mean this is perhaps slightly controversial. Some employers are afraid of employing disabled people.
In the first place. Yeah.
Absolutely. And so I think, one of the things, I mean, we spoke to many employers, and I have had employers saying to me, and they've usually prefaced it by saying, I'm not proud of what I'm about to say to you,
Mm.
but I think it's really worth being honest about it. And I kind of thank them for being honest, even though that what they're doing is not legal. Is they said, if I've got candidate A and they're brilliant, but they've got a vulnerable characteristic, or I've got candidate B who's average, they'll recruit candidate B because they don't want to take the risk that candidate A there might be a problem down the track.
Which is why Sheila's got 5 degrees and didn't get a job till she was 49.
I mean, how
Exactly.
many times have you heard that story where
Mm.
people who are very, very capable have just not been able to get into the job market? And I think it's really important that we talk about that, because I think it's also very important that we think it should then inform the solution space, because any amount of talk about how we make reasonable adjustments better, which I think is a good thing to do, by the way, won't resolve that problem, because the problem is that people aren't even getting through the door in the first place. And I think, and the further point I'd make around this whole area of exclusion is, I think, Phil, you in your intro, you were talking about 53%. But when I've spoken to disabled people, there's a very large proportion of disabled people who are self-employed.
Yes.
So they've taken the matters into their own hands. They haven't been able to get a job with another employer.
Yeah.
And so they've taken it into their own hands. So actually, arguably, the disability employment gap is actually bigger, in my view, than it is stated here. And then add to it the fact that if you've had to work incredibly hard to get into a job in the first place, then the barriers or the sort of disincentive for you to move jobs are so much greater than for somebody who doesn't have a disability. You think, crikey, it's been hard enough to get in here, so I'm not going to run the risk of moving, even frankly, if I'm dissatisfied with my job and I think I could do better somewhere else. So we've got a system which is not working, and it's and I think that's a huge problem, and we're losing out on some incredibly talented people who've got extraordinary resilience and so much to contribute at huge cost to the economy, but bluntly at enormous cost to their personal lives.
I think Phil and I are probably sitting here because we agree and know what you just said, because we've experienced it and come across it. It's a bit of a sobering thought for us because we've done a lot of work over decades and it's still the same things. You did mention internationally, there's some other countries got levers. I mean, an example of two where you thought it was quite good.
So we did quite a lot of desk research looking at other countries about their practices, but we did visits to Denmark and to the Netherlands specifically. And I think in the context of disability employment, the Denmark model was very interesting. You can't copy any other country's model. But there were a few things which are interesting about it. So the first is that in Denmark, they make it incredibly easy to fire people. So it's actually far easier to fire people in Denmark than almost anywhere else in Europe. However, they're not fired into oblivion, or they're not just chucked out of a company. They get picked up by a safety net, which is much stronger than the one that exists in this country, and is geared towards saying, right, okay, you've fallen out of that job, you've been fired from that job. So what we're going to do is figure out, what are you good at, what are you capable of doing, and where are the opportunities for you that we could try and get you into. This is for everybody. This is for disabled people and non-disabled people. No, it's not differentiating in that sense. But if you think about it from what I said before, where some employers are afraid of employing disabled people, in Denmark, generally speaking, they're not, because they're not. So you take away one of the barriers, and they've got a much better rate of employment than we have. The other point that is very interesting, and this applies particularly to people with learning difficulties and sort of some autism spectrum issues, for example. But they also have a requirement for all the municipalities in Denmark to provide participation opportunities for all the people in their municipality. Municipality is their equivalent of a region or a place. It's a sort of their devolution mechanism. So they have organizations which, if you've got someone who can't work, in a normal sort of job context because of, perhaps they've got severe learning difficulties, they have to have participation opportunities regardless. So they've got we went to visit a really impressive organization in the outskirts of Copenhagen, where there's this woman called Vibeke, who again was amazing, and she had 400 citizens, and within her operation, she had a number of different working operations, which were geared towards the capabilities of the people she was looking after. But they're also doing things like employing work coaches. And so she told us this example of the local supermarket where they employ 25 people with quite severe autism. And they employ the supermarket employs 25 people. And the organization employs 3 work coaches that work in the supermarket to act as sort of mediators and a bridge to help. And they're very experienced of working with people with autism. And they said this is an incredible success. We've got some of these people are some of the most valued colleagues they have in that supermarket. They're incredibly loyal. They laughed. They said we have to make them take holidays because they don't want to often. So I was just really struck that there are solutions out there that achieve much better outcomes. I think the other one I would just give an example to is I'm conscious I'm sort of more into the learning difficulties space, but there's an extraordinary organisation we came across in Belfast, right in the heart of the Shankill, called UCell. I can't remember what UCell stands for, but I can't remember what it stands for, but it's an amazing organisation, and they are supporting 1,500 people across Northern Ireland with various forms of disability to be in long-term work. Some of which is that they actually run themselves, and some of which is where they support people in other organisations. So there are solutions out there, which is I think is reassuring, and we're trying to sort of draw on those as much as we possibly can.
Is there I was very struck when I was in America. I did some work in America when our act came in 95. I looked at the Americans with Disabilities Act, came across an organisation, I need to be brief, where what they were doing was taking the most severely disabled people and offering guarantees to employers that if this didn't work, we would find you another person and remove the one that didn't work, and they'd find them somewhere else. Now, that sounds a bit fierce, but what they were doing, you talked earlier about the risk, particularly for smaller employers, very worried about the amount of time expended and our law system, which makes it very difficult to fire people, actually. Is there something to be said then? It sounds like Denmark and others have got this kind of net, which means that if I fall out of work, I'm immediately picked up and something else comes along. My question then is, we've got occupational health physicians, we've got occupational health, we've got insurance companies, we've got all of this panoply of things going on, advising employers. Where do they fit in all of this? Because clearly it's there, but they don't appear to be tackling the problem in
Then
the
we
way that
still
you're
have
suggesting.
job seeker advisors who
Yeah.
help disabled people as well. They used to be called DPOs and stuff. But sorry to interrupt. There's quite a lot, isn't there?
There is quite a lot, but I think it's fair to say that the UK has kind of historically prided itself on having a pretty liberal labour market, which has relatively few requirements on employers, and it's been a bit more North American, a bit more freewheeling than some of our continental European economies. And there's probably arguments either way about whether that's worked or not. You do hear people saying it's actually compared to France or Germany, it's much easier to employ people in the UK, because although it's not easy to fire people, it's easier than it is there. But I think what's happened is, and then in the context of occupational health, it's a legal requirement to have that in place in quite a lot of European countries. It's not a legal requirement to have that in place in the UK. And so what we have is quite a patchwork quilt of provision in the UK in terms of what employers actually have in place. It's of highly varied quality, some very, very good. And you have amazing employers doing great stuff in-house, and some who contract that in, others who have group income protection policies, and they basically outsource that to the big insurance companies, and they, on the whole, do a pretty good job, all the way through to nothing. And in between, you've got employer assistance programs, which are relatively cheaper, but also the utilization isn't as great, and they're kind of a bit more in the employee benefits front rather than sort of really embedded in the management practices. So we have got a weaker system, I think, truthfully. And again, you can argue whether that's been a good thing or a bad thing. But what is happening now is we are getting older as a society.
Yeah.
We are getting sicker sooner, and we're also getting iller younger, because there has been a huge surge in mental health issues amongst younger people. And of course, there's also a lot of comorbidities across all of this space. So if somebody falls out of work with one condition, it's very common for them to then develop others, because once they become isolated or removed from the world of work, that is what can happen, or they become less active. That's what can happen. So I really think that the system, or the lack of a system that we've had historically, may or may not have worked. But what I'm absolutely clear on is it will not work going forward, and we need to see a fundamental reset in terms of how we handle and support people with ill health, and how we support people with disability to get in and stay in work.
I like where you're heading. I mean, this is big, significant culture shift. I'm going to throw a little curveball in because it's very topical. I heard Andy Burnham be interviewed about would he cut welfare to give more money to defence, and he said yes. But he said, I would do that by supporting those disabled people and those people with ill health into work. Therefore, the welfare bill will drop down. Therefore, I can put more money into defence. Does that sound, I mean, is that, I'm not specifically part of the plan, but is that kind of part of this?
Well, I think I think most people would agree that it's better to spend money on getting people into work than on paying them not to be in work if they're able to work. That's definitely the case. The difficulty is always the judgment that you reach about who is capable of work and to what extent. And I think so a couple of things I'd say. One is that, again, in terms of lessons from other countries, in the Netherlands, the professionalism and the rigor with which they assess your work capability is on a different level to what we do here, a different level. And then they've built their systems and the incentives around that in a way which means that, you know, people do get benefits if they really need them, but they only get as much as they should have depending on their workability. So it's almost that the focus is on what can you do, not what you can't do. Whereas I think here we tend to end up sort of just saying to people, no, you can't work. It's a binary thing, which is crazy. But I think the other point I would make is that, which sort of relates to what Andy Burnham. I mean, if we can get more people into work, that would be a really good thing. It would reduce the welfare bill, it would boost the economy. Of that, I'm sure. And I would also say that actually, when you look at all the opportunities and the challenges we face as a country, I don't think it's an exaggeration to say that doing better on this front is one of the biggest single economic opportunities we face to grow and to improve our economic performance, let alone the benefits that would accrue in terms of life chances and personal benefits for the people affected. And the reason I say that is because actually a lot of the solutions are within our grasp. They're things we can do. We do not have to learn to do loads of brand new things that no one's ever done. We just have to coordinate better and put together our systems and tap into the incentives that are already there and the will and the capability that's already there to get much better outcomes. And on that, I mean, I think one of the things that we did within Keep Britain Working is, as part of the review, we basically went out and asked employers to sign up and say they wanted to be vanguards. And essentially what we said is what this means is you're saying to us and to the world, you want to work, you care about this issue and you want to work with us to try and solve it. That's basically what they're saying. And at the point of publication, we had 60. We've now got over 180. We had 5 mayoral authorities at the beginning. We've now got 10 for all the devolved administrations. And one of the interesting things we did with those vanguards is soon after we published the review, we wrote to them all and we said we're going to do a survey and ask them of the various different areas you might now want to work with us on in terms of problem solving. You know, what's your level of appetite? And honestly, across a number of it was things like musculoskeletal issues, mental health issues. We asked about disability, inclusion, various things. 74% of the respondents said they wanted to be working with us around how we could improve disability inclusion. And I took great encouragement. And by the way, that was pretty much the same as it was for some of the other things. So I took great encouragement from the fact there's a lot of employers out there who they know kind of like feel that we're not good enough and they want to be better. And so what we're doing is we're working with them to try and figure out how. And that's an incredibly valuable resource.
Can I'm this is very, very, very interesting. I'm hearing the listener that's sitting at home listening to this, a bit like me saying, I've heard all this before.
Mm.
This is, you said at the beginning of our conversation that, you know,
Yeah.
you're in the long line of people that have written
Yeah.
reports. And while some of the things you're saying, I think are pretty unusual and unique, which is great, the cynical listener is saying, I've got to say on their behalf, what's going to change here? We've heard employers before sign up for things like the disability 2-tick system and then the disability convent thing.
Yep.
And the evidence seems to suggest otherwise. So, for example, you mentioned access to work. Access to work is, you put it much more diplomatically than I'm going to, which is it's fallen to bits. I mean, getting people into work via access to work is taking months and months and months. So, long-winded thing. Can you help me understand what's going to be different this time around?
So, and in a way, that is the challenge that we're kind of taking on. And I'm not yet in a position to say to you, we've got it all sorted, because it's quite difficult. But what I can say to you is that I believe that we have got to crack the question of how do we properly measure the outcome we care about. If we want to improve it, we've got to start measuring it. So, and what we will want to see is more disabled people in employment. That's what we want to see. You know, and And yet we don't really have a good measure of that, not at a firm level or a sector level or a regional level. And so what we want to try to do is to figure out how could we measure much more reliably and more frequently the level of participation by disabled people in different organizations. And I think one of the criticisms that I've heard loud and clear around disability confident is that it's got some quite good bits in it. I mean, there's some quite good things in it. But there's a sense from quite a lot of disabled people I've spoken to, which is that it's all very well, but the outcome isn't what you would expect given the inputs. It says all these good intentions, but the outcome is there still aren't opportunities and jobs for disabled people. Mm. And so I would like to see a situation where we find a way to bring outcome measures into that equation. And therefore, you can't just be a top tier disability confident employer unless you're employing more disabled people and probably a growing number of disabled people. And the good news is that I actually think that there are quite a lot of employers who want to do that. I don't believe that. I mean, look, sometimes employers will do things because for reasons of PR, but on the whole, I suspect that the 19,000 people who are or employers who are members of Disability Confident actually, at some level at least, do want to improve the employment outcomes of disabled people and be more inclusive. But what we've got to do is be able to tell them that they're either in the top tier in terms of actual outcomes or the bottom tier. Wouldn't it be interesting if we were able to say, let's imagine a large professional services firm. Wouldn't it be great if we could say to them, do you know what, you've got about 20% of people in your organization are disabled, but your competitor over there has got 30%. What do you think about that? And don't you think you should therefore look at how you can improve? And I think that kind of information could be very, very powerful. And of course, that's not to the exclusion of then tackling some of the mechanisms that help to achieve better outcomes, like access to work, like reasonable adjustments. But those are all parts of the process that get you to the outcome. And I want to put a bigger focus on the outcome.
I'm quite well known for saying things and then not actually answering questions. So, Charlie, you'll have to work out my point here. The bit I'm still struck on is this shift, and I really like it, as in how we think. And at the risk of blowing Phil and my own trumpet, we've both delivered career development programs for managers who are disabled, divergent, long-term health conditions at HSBC and Lloyd's and other big organizations. One of the things in that course is to get them to take over the management of themselves, to lose that fear we talked about. If their career's stopped, is it related to their condition or is it something else? And we pull it all apart, put it all back together, and off they go. And hopefully their career will develop. What's started to happen for me now is that the managers of those individuals are saying, hold up, we have these people come back who are so engaged and so alive. Well, they're not ready. So now we have to train the managers to get them ready to be really good at this.
Yeah.
I haven't worked out my question, but what I'm sensing from some of the things is that intensity could be really helpful. I love the international model of so much support. So we remove the stigma. This is just normal, the normal case or normal process. I suppose my fear is, how do we do that at scale? How do we do that with large numbers of people?
Well, I think so. I think there's going to need to be a number of components to any answer. I don't think if there was a simple answer to this, somebody probably would have found it. If I'm honest about it, I do think this focus on outcomes is potentially of enormous importance. If we could start to reliably measure how many disabled people there are employed in different organizations, that would be a very powerful piece of information that we could then use in lots of ways to drive better outcomes. And of course, one of the interesting questions is, how do you collect that data? Because if you just go to somebody and say, are you disabled? And it depends who's asking the question as well, of course. There's 101 reasons why they might not want to tell you that. There'll be some people who are disabled, don't even realize it, but actually, but they would qualify as being disabled, but they wouldn't necessarily describe themselves as that. So we're actually doing some work right now to figure out how could you overcome some of the challenges of collecting the data so that you could get that data set. And then if you had that, how could you then start using it? Because I think the thing is, for something like Keep Britain Working, we're trying to grapple with a sort of a nation, which is and all the employers within it, to drive better outcomes. What we can't do, because it would be impossible for us as a team or even an organization, is to fine tune the answer for every single eventuality. We can probably only do a few things which change the direction of the conversation and tap into the will there is. So I think once you get that to start happening, then quite a lot of secondary effects can start to take place, which help. So I think outcome measures is incredibly important, and I kind of want to test the destruction, how we could go about getting better data around that, and then I think it's really interesting about what you could do with it and how you could use it. We want to, secondly, improve the support that's available to employers to help them to support their employees. And so we're doing quite a lot of work with providers and with other people to say, how can we configure that? What should it look like so that we can get that to work? And then down the track, when we've figured out the what and the how, we also have said to the government from right at the beginning is you've got a job to do, because you're going to need to create the right incentives which encourage people to want to come on this journey. And we, by the way, we haven't specified what those incentives are yet. But the truth is that if imagine a scenario where somebody provides a participation opportunity for someone, and they therefore have a long and fulfilling career. Not only is it great for that individual and probably good for the company, but actually it's really good for the entire country, and it's really beneficial. And so, down the track, once we've built up some momentum and built some evidence, we've absolutely said to the government, we need you to step in and say, right, how do you encourage people to come on this journey? And there's a whole range of things you could do, from saying this is part of public procurement measures, through to providing perhaps tax relief on certain aspects, through to perhaps saying that if you're doing this and you're demonstrating you're a very good employer on the following criteria, and we've got good data to show it, maybe you get the benefit of other incentives as well. So we think there's a lot of opportunity to do some of that.
Charlie, can I just ask, jumping back to the initial data that I read out, and I said that one of the figures that stood out to me was the 300,000 people joining the queue every year.
Yeah.
So it feels like, in a sense, what we've got is we're filling a bath, and we've got the plug out. So as fast as you are coming up with initiatives to get people into work, they're leaving in droves, because the employers are not, and I'm not having a go at employers here, but for whatever reason, people find it very easy to be got rid of. Interesting that Denmark think we're a bit worse at it than them. But this idea that we need to turn the tap off, as well as approach those that are already out of work to get them back in. So how do we stop 300,000 people joining that queue every year?
So we're doing a number of things. I mean, essentially, we are saying that employers have got to get much better at supporting people so they stay in work. Quite a large number of that 300,000 wouldn't need to leave work if they were better supported to stay in work. Some would, of course, because you always will have that, but quite a number of them would not. And so what we are essentially saying is that we're really trying to develop something called, we call it the healthy working life cycle. And essentially it's about saying to employers that you need to get on the pitch. It's not good enough for you to say that health and or disability is an issue for the individual and whoever's supporting them, and it's kind of not my problem. It's over to you. And as soon as you can't do the job, well, thanks for being here, but we'll let you drift off. That's not good enough. What we're actually saying is, no, you, the employer, have got to be engaged in this. We need you on the pitch. But in order for you to do that, we've got to be clear with you about what that means. It doesn't mean you can't, it's not reasonable to expect employers to have magic wands and improve every aspect of everybody's lives. But we do expect you to be engaged, to take accountability for health and for disability in your workplace, and to making that a better and more supportive environment. Secondly, we're saying that the employee has responsibility, and that I think there's a lot of employers who sort of slightly throw their hands up in the air and say, "Oh, there's nothing we can do about this because some of our employees aren't playing ball." And I say to them, you know what? Have you looked at your contracts? Have you actually been clear about whether or not the way you've structured your contracts means that they're geared towards engagement? So you shouldn't have. I think that the notion of something for nothing is a good one. You shouldn't have a situation where if you say to people, you can be off sick for months on end and be paid sick pay at a high rate, but have no requirement to engage with the organisation about how we can rehabilitate you and get you back into work. That shouldn't be okay, shouldn't be the norm. So the employee has some work to do. Providers are very, very important. It's not possible for employers on their own to solve all the issues that they may face. I mean, you mentioned training. I think Simon mentioned training a moment ago, training of line managers. And I think it's a good thing to do, but it's impossible to train all the line managers to cope with every single situation they may face and to do it quickly and efficiently and effectively. So we've got to get the provider industry of occupational health, of insurance companies, of all sorts of different organizations to step up and figure out how can we provide good support for employers and employees at an affordable and accessible price. And we think actually that's very doable. I was in Hull yesterday, and we were talking about. I was with partly run by the city council, partly by this company called Latus, and they're setting up a Hull resilience hub, which is basically £50 per person per year. And they provide a pretty impressive suite of support, which is very proactive. It's got health checks, it's got, it's a proactive support operation, all with a view of stopping people from leaving work. And so the providers have got a big job to do, and that's an example of where we're seeing some innovation there, and we think there could be a lot more. And then the government's got to play a role to play. I talked before about incentivizing people and getting that all lined up. They've got work to do to make that work. So all those four areas, I believe, could make a big difference in this space.
Okay.
I'm looking
We're
at the
running
clock
out of
and
time now. Yes.
yeah.
Yeah, I'm getting twitchy.
Just one little, when you're trying to find out the numbers of disabled people in employment within organisations, something I found now, if I use the word access, do you have any access needs? People come forward. If I say, are you disabled? There's a 50-50 chance they won't say it. But I have three quick fire ones. One, which is one thing that you really hope will absolutely land from your recommendations. One thing you think, okay, that may not happen. And my last question is, how long are you around for?
Okay. So I'm a bit of an optimist, so I find it quite difficult to say what
I
won't
know
happen.
it's a mean one.
I think, I mean, in terms of what I mean, I'm gonna go a bit general. I mean, I'll be very clear. I think we want to try and pull off a fundamental reset in terms of how ill health and disability is handled across the UK, in the workforce across the UK. And I say that it's easy to say, it's obviously hard to do, but I think anything less than that, setting out to achieve anything less than that, would be wrong, because the scale of the problem and therefore the scale of the opportunity is such that it warrants us really being ambitious about how we do it. I say that, though, not because I'm pessimistic. I mean, I think I'm realistic about how hard it will be to do it. But I've been so hugely encouraged by the response that we've seen from a lot of employers and providers and other organizations out there, because we're not doing this on our own. It's not just me and my smallish team. Actually, we've got a growing coalition of people who recognize that this is a problem that we need to solve. And they've got, a lot of those people have got the capability and the resources to do it. It's really a question about coordinating it and joining it up better and helping it, getting some barriers out the way, and then getting the whole thing to work better going forward. So I think we can do it. That's my first question. In terms of what we may not achieve, I'm going to slightly duck that, because I'm not prepared to.
Yeah, it's too early.
We sort of got. I don't know yet. And then in terms of how long am I around for? Well, look, I signed up. I'm co-chair. I'm one of four co-chairs of the implementation phase. So, having done the review, I basically said to the government, right, you've got to do three things, and one of them was to back it with senior leadership. And so there are four co-chairs. It's the three secretaries of state from Department for Work and Health, Work and Pensions, Department for Health and Social Care, and Department for Business and Trade, and me. I also then say that I say that's good, because we need them to have skin in the game, but I also understand that the division of labour across the four of us is going to be quite uneven, which of course it is. But we've got a good team. We're growing that team. We've got some fantastic support coming through from employers, and some of the people there, they're giving their time and their expertise in a way which I'm hugely grateful for. And so I kind of say to you, I'll be around for as long as it takes to make this happen. I'm certainly not planning to go away anywhere. It feels incredibly important.
I suppose
To stop it risking being another fabulous report with great ideas that then just falls by. But sorry.
I was just going to say that obviously some of this is at the whim of whoever the government is. Let's just hope that this. I would argue, and I think you have very, very articulately argued, this isn't a political issue, actually.
No,
this is about the benefit, the welfare of the whole country. So whatever government's in power should put their money behind this, because it strikes me, if they don't, Simon and I will have someone like you again in 10 years' time saying,
Yeah.
I've done this review, and here we go. But it's been
And
a pleasure.
in a way, the trick is to make it, part of this is about saying, let's stop looking to the government to solve problems that are better solved elsewhere.
Yeah.
Let's recognize they've got a role to play, but you can't outsource all the problems to the government.
No.
Because that's when things just don't happen, because they simply can't. They haven't got the capacity or the time or the attention span. So let's say, you know what, the best people to solve this are actually employers predominantly. And what we've got to do is figure out the solutions to a level which makes them highly implementable with a lot of support, a really strong coalition of support. At which point you then say to the government, right, well, why on earth wouldn't you back that? Because you'd be mad not to. And actually, if we're going to do all of this stuff, we need you to do quite precisely this, and this, but not all of that, because we've sorted that over here. So why wouldn't you get on with it if this is going to improve the lives of the people who've elected you, and indeed some who haven't, and it's going to improve the economy and help you to have more money to spend on public services and all the other good things you might want to.
Sounds like a good place to end to me. A very optimistic note.
Well, we've got a lot to do, so I'm realistic, but I feel it's important work, and actually, to be honest, I feel very fortunate to have had the opportunity to spend 9 months during the review all across the country getting into this and meeting so many people. I couldn't be speaking like this. I would not have been speaking like this in January 2025 because we hadn't done the work. We've done the work, and frankly, it gets under your skin, and you feel a sense of its importance, and also you can see how we could go about making a difference.
Yeah.
I also think, and this is me being more realistic, is that the revolution you're talking about, which I think it is amazing. I genuinely think we have these incremental changes. So whatever it is that you do will move it forward, even if we don't get quite to where it is. So long as it keeps improving, I just wish it could be a lot quicker.
I suppose there's no doubt at all in my mind, Charlie, that you've got the passion and the energy that comes off you in waves. And I think that's not a joke. I think that matters. I think to get this thing rolling, you've got to have both of those. And I think Simon and I have spent many, many hours with people who say stuff but don't really mean it. You can tell the passionate ones, and I think you're one of them. So good luck is what I say.
That is kind of you. Well, we may, hopefully we won't need too much of it, but we certainly need momentum. I'm a great believer that most of the world's problems get solved not instantly, but over time, and momentum is key to that.
Well, thank you very much.
Thank you so much for your time.
Thank you, Simon. Thank you, Phil.
Thank you very much.
Thank you very much indeed.
It was
Been a
lovely to
pleasure
meet you.
meeting you. Take care.
You too. Thanks a lot.
Bye-bye.
Thanks.
Bye.
Bye.